Hi, welcome back. Here today I am with an important topic for discussion which is on burns. Here we are going to see a very tricky question which is on priority. So I'm going to discuss this with an scenario. Here it says which client should the nurse assess first. The options here are A client with 40% total burn surface area whose urine output is 20 ml per hour. B. A client with facial burns who is speaking clearly and reports mild throat tightness. And C. A client with deep partial thickness burns requesting IV pain medication. D. A client with burns on both arms whose temperature is 38.5 degree Celsius, that is 0.1.3 degree Fahrenheit. So please think which is the correct option. Yes, we always think a low urine output because fluids are critical, but this what we select, it is wrong. In reality, the priority where what Nclex wants us to think is, yes, it is the potential airway loss. So the facial burns and the throat tightness in option B, which says there is an impending airway edema or the airway might close suddenly in some time. So this is the immediate priority. So we should choose this particular option because there is a lot of pathophysiological changes after a burn injury, especially in a facial burn. Once the patient sustains a facial burn, the airway is involved, there is a lot of edematic changes which happens. So we have to always secure the airway. If at all the patient is not having any problem also, we have to secure the airway and intubate the patient in advance, so as to prevent the major loss. Later we cannot intubate the patient because a lot of edematous changes makes us difficult to even intubate the patient at that particular point of time. So we can see why the other options are wrong. Is the option A says low urine output is serious but it is not immediate, as fatal as an airway obstruction. And option C, the pain aspect is very important but it is not a life-threatening situation. Again, option D, fever suggests infection but this is not most urgent, which is going to erupt at this particular point of time. The Nclex rule always says the airway problem or the suspected airway problem and the swelling always stands at the most priority than the other problems such as circulation, pain and urine output issues. So I hope this has given some knowledge regarding the burns topic. Thank you and happy learning.